True Crime Brewery contains disturbing content related to real-life crimes. Medical information is opinion based on facts of a crime and should not be interpreted as medical advice or treatment. Listener discretion is advised.
Child killer Marybeth Tinning of Schenectady has just been denied parole again. Tinning was convicted back in 1987 of killing her 4-month-old daughter Tammy Lynn, smothering her with a pillow. Tinning had 9 children. All of them died in infancy or just beyond. At first, it was thought they all died of SIDS or something possibly caused by some genetic disorder. Eventually, though, authorities came to believe she killed 8 of the 9. She confessed to 3 of those killings, sentenced to 20 years to life on the one murder of Tammy Lynn. This was her 4th time up for parole, and again, for the 4th time, she was denied.
Welcome to True Crime Brewery. I'm Jill.
And I'm Dick.
The story of Marybeth Tinning and her 9 deceased children is one of the worst cases of Munchausen syndrome by proxy in the history of the disorder. Between the years of 1967 and 1985, Marybeth, a wife and mother in upstate New York, gave birth to and buried every one of her babies and young children, often within months of one another. The eldest, Barbara Ann, was born in 1967. By 1972, both little Barbara and her 2 siblings had died, starting with 8-day-old Jennifer, who is the only Tinning child believed to have died of natural, medically explained causes. Now the rest died inexplicably, all dead before they were old enough to attend kindergarten. Most of them were too young to walk or even talk. Marybeth repeatedly sought the attention of medical professionals, but no one spoke up to say that her actions were suspicious. They examined each child for symptoms, found none, and sent Marybeth home, where her child would die soon after. Marybeth was always the one to find them, blue and unresponsive. By the 5th death, doctors were calling the cause of most of these deaths sudden infant death syndrome, SIDS. The belief began to circulate in the town of Schenectady, New York, that the Tinning family suffered from a death gene. Marybeth was asked by concerned acquaintances and family members why she continued to bring more babies into the world, since they seemed destined to die so young. Marybeth said she was a woman, and that's what women are supposed to do. After 14 years of deaths, Marybeth Tinning was finally arrested for the murders of Barbara Ann, Joseph, Jennifer, Mary Frances, Timothy, Nathan, Michael, Jonathan, and Tammy Lynn Tinning. The autopsy of her youngest, Tammy Lynn, had shown signs of manual suffocation. Marybeth told varying stories about her involvement. To this day, her husband, the father of her 9 dead children, stands by her. Join us at the Quiet End today for an unbelievable and startling story of murder, followed by a discussion of sudden infant death syndrome, Munchausen syndrome by proxy, child protective agencies, and the criminal justice system. I've asked Dick to bring in a heavy-hitting beer today because this case can really be not only upsetting, but incredibly frustrating. As a mother, hell, as a human being, I just can't understand how this woman was able to repeat these horrible acts over and over with no one intervening to protect the most innocent victims.
So today's beer, this is from Single Cut Beersmiths in Astoria, Queens, New York. So it's not quite upstate, but still a New York beer. The beer is a double IPA called Softly Spoken Magic Spells, and it's 8.6% alcohol by volume.
And that is from a song, and I've tried to think of what the song is. I'll come up with it.
Okay, keep those thought processes going.
It's definitely in a song.
So the beer's a hazy orange color with a fairly decent-sized white head that left a good amount of lacing. Pretty beer. Got a citrus and tropical fruit aroma primarily, and there's a little pine in there also. Wonderful taste. You get some orange and grapefruit that would take care of the citrus part, and papaya and pineapple. There's the tropical fruit, and a little late pine. There's the resin. Great beer. Medium-bodied, very drinkable. Just not a lot at once because it is 8.6%.
Okay, well, that's what I wanted, was something to take the edge off.
Okay, this will do it.
All right, let's open it up.
All right, we'll head on down to the quiet end.
Okay, We're all settled in here. Let's get started with you, Dick. You can start off our case.
Okay. Marybeth's father, Alton L. Rowe, died of a sudden heart attack in October 1971. This was just 3 months before Marybeth's 8-day-old daughter Jennifer died. Now, Jennifer's death was different from all those that followed. She had an infection, probably early onset group B strep, and was kept in the hospital from her birth until her death 8 days later. Now, back in the early 70s, we didn't test for this. A lot of women carried this particular form of strep in their birth canals.
And this is something that's tested for during pregnancy.
It is now, wasn't then.
Wasn't then. Okay.
No. So what happened back in the 40 or so years ago was that the baby would get colonized as it was delivered vaginally.
Which means it would catch the germ.
Would catch the germ and get very sick very quickly. High mortality rate. So what's happened since is that people now can be tested and find out whether they have group B strep. And if they do, they get treated with antibiotics at the time they're in labor. And this effectively prevents the early onset form of group B strep.
So this saves a lot of babies.
Saves a ton of babies. There's a later form that's not as severe. And that's something that just kind of happens, so we don't pick that up. But the devastating early onset group B strep is pretty much a thing of the past, with proper identification and treatment before delivery.
Yes. Now, what if it's not identified until after delivery? What if the woman gives birth in a cab, for example?
Then there's blood work done on the baby. And if it's abnormal at all, the baby gets started right away on antibiotics. And if there's any risk factors, so say she gave birth in the cab but had a fever or had an odor to the amniotic fluid, or the baby was running a fever early on, then you don't even wait for the blood work to show what's going on. You just go ahead and start treatment at the time you do the blood work.
So once again, antibiotics to the rescue. I mean, those are amazing things.
They've proven to be of tremendous benefit.
Yes.
So many believe that it was Jennifer's death right after the unexpected death of her father that set Marybeth onto a disturbed path. Each of her 8 subsequent children were healthy at birth, seemed to thrive, and then suddenly died. They died when they were with Marybeth, and Marybeth only. None of them died in the presence of other people.
No, sometimes her husband was around, but no, she was always the one to find them.
Marybeth saw different doctors and nurses in different emergency rooms, and they all believed her to be credible. When she ran in with a limp baby in her arms, the focus was on resuscitating the child, not to examine the child for any physical signs of abuse. And the frantic and futile resuscitation attempts inevitably left marks on the baby. So afterwards, it was generally impossible to distinguish marks, possibly from abuse, from marks sustained from resuscitation. And then, at the same time, Marybeth was a grieving mother, so it seemed heartless and cruel to interrogate her.
I could see that would be a difficult thing to do.
Now, between 1970 and 1980, when the first 7 Tinning children died, 2 theories about the cases of sudden deaths surfaced. In babies, it was sudden infant death syndrome, known as SIDS or crib death. In her older children, it was the thought of Reye syndrome. Now, many infant deaths are described as SIDS deaths, but SIDS isn't a medical diagnosis. In the 70s, hospital staff was hesitant to question traumatized parents. Now, fortunately, a growing awareness of child abuse has made it unlikely that a mother could get away with murder to the extent that Marybeth Tinning did.
And I think that's absolutely true, as we'll see in most recent cases. If this happens to 1, maybe 2 children, the baby's taken away, at least for observation, and see how the baby does when the baby's away from the parent.
Yeah, absolutely.
Yeah.
But even back then, once they saw the pattern, it seems that something could have been done.
It seems ridiculous, doesn't it?
It's mind-boggling.
Of course, we're looking at the overall, and a part of the problem was that people just saw bits and pieces here and there.
Right, and there was definitely a lack of communication between different hospitals, different agencies.
Different coroner's offices, yeah.
Yep.
Let's talk a little bit about Marybeth's history.
Okay.
She was born back in 1942 in Duanesburg, New York. And she was an average student at the high school. She ended up being a nursing assistant at Ellis Hospital in New York. And she met Joe Tinning on a blind date in 1963 and they got married 2 years later, 1965. Before she had Jennifer, Marybeth had 2 healthy babies in 1967 and 1970, and things seemed fine. These were chubby, sturdy, blonde babies who were always clean and well-dressed. They appeared well-nourished and loved by Marybeth and by Joe. The family lived in half of a 2-family house in a lower middle-class neighborhood called Mount Pleasant. Now, this was an old section of town and only a short walk to work for Joe, who worked at the General Electric plant. They fit into the neighborhood pretty well, just like the other couples. They're in their 20s, they're having babies, and they're just making ends meet. Marybeth became pregnant with Jennifer in the spring of 1971, and this one was a difficult pregnancy. Marybeth was often sick, tired, and weak during this pregnancy. She had a hard time also caring for the other 2 children she had, Barbara and little Joey. So her mother-in-law, Edna Tinning, was the one who took care of them for several weeks during the pregnancy. Marybeth's mother was kind of an invalid. She had severe arthritis and wasn't able to help. So Marybeth actually had to help her with some things. But she wasn't really able to pitch in with the kids, so Marybeth was thankful to have Joe's mom, Edna, around to help. Now, it was in Marybeth's 7th month of pregnancy when her dad died. He was only 54, and he had a sudden heart attack at his job at the GE plant. This was a shock to the family, and Marybeth was quite grief-stricken. She was crying for weeks over this. Jennifer was born on December 26th. When she died on January 3rd, Marybeth seemed to take this death more calmly. But some of the staff at St. Clair's Hospital did think her behavior was odd. When asked if she would like to hold the baby's body, Marybeth took it under the bedsheets with her for a while. Now, this may have been her way of grieving, but she had this flat affect and lack of tears that troubled some of the nurses there. Maternity units now have programs and counseling to help women after they lose a baby, but there wasn't anything like that back then for Marybeth. Back then, there was a widespread belief that the less the tragedy was talked about, the sooner the woman could move on with her life. And that seemed to be Marybeth's attitude.
Now, Marybeth set a pattern for all the funerals to follow Jennifer's by having an open coffin and putting a toy inside. Joe was raised to be stoic, and he sat in the funeral home stone-faced and withdrawn. The couple was considered a bit strange, but friends and relatives believed Marybeth was a good mother who loved her children. And she still had 2 healthy children at home.
That's right, so that makes her seem pretty normal.
Right. These were beautiful, well-cared-for children who Marybeth could be proud of. But then, 17 days after Jennifer's death, Joey suddenly died, and his death was followed 6 weeks later by Barbara's.
So this would be the point where I would say, holy shit, we really need to look into this. This is not normal.
Exactly. Right?
Right.
In a period of 6 weeks?
Yes.
Or so, you've lost 3 children.
Yeah, 2 months. Now, both Joey and Barbara had the same unexplained symptoms, which quickly killed them. But still.
Yeah, both were reported to have had seizures when they were home with their mother. Now, I would only mention that these seizures were never witnessed by medical personnel.
No. Mm-mm.
Marybeth took each child to Ellis Hospital's emergency room twice. She avoided St. Clair's Hospital, where Jennifer had died, even though it was closer. Now, maybe there was bad memories about St. Clair's, whatever.
I think that's what most people thought at the time. They could kind of understand it.
She took both kids to Ellis Hospital. So the first visit was for the purported seizures, and then on each second visit, each child was beyond saving. Now, no connection seemed to be made between the 2 deaths by the doctors at Ellis, and it's unclear if they were even aware of Jennifer's recent birth and death.
And they might not have been.
They might not have been, because it's another hospital.
Right.
And I would think unless Marybeth volunteered the information, they weren't going to find out.
Yeah, I would guess. But, I think you do a history when you get there, but she could have left things out.
Well, she can leave things out, sure.
Right. Well, little Joey got sick during the week of his 2nd birthday, so he wasn't an infant. Marybeth took him to Ellis with the story that he'd had a seizure and he'd choked on his vomit. Now, he was kept for observation for 3 days, but they found nothing wrong with him. Just a few hours after he was discharged, Marybeth brought him back to the hospital. He was dead. Marybeth said that he complained of being tired, so she put him down for a nap, and when she went in to check on him, he was blue and tangled up in his sheet. Doctors would speculate that he may have had Reye syndrome, but without a positive diagnosis, they recorded the cause of death as cardiorespiratory arrest, and there was no autopsy. Do you want to take a break here and explain Reye syndrome, or do you want to do that later?
I'll talk about it.
Okay. Let's have a little lesson.
It's a fascinating illness. It really is. So it was first described by, I think it was an Australian physician named Reye, R-E-Y-E. And it's an illness that has liver failure and central nervous system swelling and ultimately death. Very interesting syndrome. So it usually follows what looks to be a simple viral illness. And as the kids start seeming to be better, they suddenly decompensate. And there's a fairly high mortality rate, upwards of 40%. Well, what kills them is not just the liver failure, but they get such tremendous swelling of the brain that they herniate the brainstem through the base of the skull.
Oh, that's the same as shaken baby.
Right.
Right.
Because they have swelling, tremendous brain swelling.
Mm-hmm.
And the increased pressure of the brain is what kills them.
That just sounds like it's probably painful, which really breaks my heart.
Well, they're comatose.
You don't think people in comas can feel pain?
Not as much.
Well, not as... Okay. But they might. We don't know. They might feel pain.
They don't respond to pain.
No, but maybe their bodies aren't able to respond.
I'll just leave it at that.
Okay. I don't know.
They don't respond to pain. And there's other ways of telling whether something is painful than what the body does.
Okay. We'll leave it at that then. So probably not.
Probably not.
Okay. Well, that's good. I'm glad to hear that.
Now, here's the interesting thing. Until probably the early 70s, it was basically an unknown disease. And then in the early 70s, there were clusters of cases, huge numbers. And I remember when I was starting my medical career, I was a resident. We saw a lot of kids, and we hated it because it was a high mortality. I mean, just dealing with sick and dying infants, babies, was really difficult. So the interesting thing is that besides noticing that there's an association between a viral infection and the onset of Reye syndrome, it was eventually found out that aspirin played a role. Because back in the day, that's what we used for kids with fever and illness. They all took aspirin. Nobody took Tylenol or ibuprofen. And so there's an association with aspirin. The warning came out, do not give a sick child aspirin. And Reye syndrome has virtually disappeared.
And then the Tylenol company was thrilled.
Yeah.
Right?
Probably.
They took off in the...
Although Tylenol can cause liver disease too, if you take enough of it.
Sure. But not in normal doses.
Right. But aspirin in appropriate dosing played a role. So now we don't use aspirin in little kids, and we don't see Reye syndrome.
So that's why they call the low-dose aspirin that people take for their heart baby aspirin, because babies actually used to take it.
That's what they took. Now, and the other thing that was found out was that there is a host of metabolic disorders that can mimic Reye syndrome in terms of the chemical findings and physical findings. So this has led to a whole bunch of research on those things. There's urea cycle defects that work in the liver that can produce symptoms like Reye syndrome. There's a syndrome called acyl-CoA dehydrogenase that mimics Reye syndrome. And these are just fascinating metabolic things. I guess you have to be kind of a geek to appreciate the metabolic stuff.
But that's a lot of the stuff they did consider, so that's good to know.
They did. Now, I was looking to see, because one of the pathognomonic findings for Reye syndrome is that there's a markedly elevated ammonia level in the babies. I had a tough time finding if there were liver function tests or ammonia tests done. I know on the older kids that one or two of them got transferred to Boston Children's for further evaluation.
Yeah, and I think that I do have some information on that we'll touch upon later in the discussion.
Okay.
Yep.
But they never found anything that suggested Reye syndrome, even at Boston Children's Hospital.
No. And little Joey died on January 20th, 1972. On the evening of March 1st, Marybeth rushed 4-year-old Barbara. And Barbara was almost 5. I think she was like 4 3/4, so she was an older girl. She rushed her to the Ellis ER. Marybeth reported that Barbara had gone into convulsions and had trouble breathing shortly after she was put to bed. Doctors wanted Barbara to stay in the hospital overnight, but Marybeth insisted on taking her home. So to me, that's really alarming, because if you just had 2 babies die, wouldn't you want your other baby to be watched like a hawk?
Well, I sure would.
Yeah, most people would.
But on the other hand, they kept the little Joey for 3 days and didn't find anything wrong with him. So maybe she figured they didn't find anything with Joey, they won't find anything with Barbara.
Well, I think we know looking back that that's not true, though.
I know.
Okay.
But I was trying to be helpful
Well,
too.
it's something that could be considered, yeah.
Yeah.
Well, later that night, Barbara was brought back to the ER and she was unconscious. She was resuscitated and put in the intensive care unit where she was in a coma, and she died the next day. Barbara's death wasn't reported to the medical examiner, but there was an autopsy performed. Because Barbara was reported to have a fever and convulsions, it was decided that she had died of Reye's syndrome. Now, like you said, at the time, Reye's syndrome wasn't really understood. But 14 years later, doctors on what they had developed, a Tinning task force, and state forensic team thought that neither Barbara nor Joey had the classic symptoms of Reye's. Instead, they determined that both could have been suffocated. If this happened, though, there would have been quite a struggle, especially with Barbara, who was almost 5 years old.
I would only offer this if they did an autopsy on Barbara, they would have seen changes in the liver that were consistent with Reye syndrome. So I'm not sure how, absent those microscopic findings, how they could even consider Reye syndrome. And same with the central nervous system. There would be specific findings.
Yeah, I don't think that anyone's going to argue that everything was done correctly. Things were definitely overlooked, right?
Yeah.
Yeah.
Now, I guess I can see with fever and convulsions that she could have had Reye syndrome, but there could have been a whole bunch of other things that would cause fever and convulsions.
Right. Well, according to a relative, Marybeth had punished Barbara on the evening that Barbara got sick. Barbara had been playing at a neighbor's house and she fussed about coming home. There was a tantrum and she was sent to her room. And shortly after that was when Marybeth claimed to find her having convulsions. After Barbara's death, there was a lot of gossip among the Tinnings' neighbors, as you can imagine. Some of them wondered if the children had been poisoned. Barbara and Joey seemed like very normal, healthy children, and it just didn't seem to make sense. They were buried alongside Jennifer and Marybeth's father, and she had 2 open caskets. So this was a heartbreaking sight. Can you even imagine this funeral? I mean, neighbor ladies were in tears. But Marybeth was dry-eyed and kind of like she was hosting a party.
Very unemotional. So that Easter, a month after Barbara's death, Marybeth told a strange story about 2 Easter baskets being left at her front door for her 2 dead children. That's weird.
Yeah.
Marybeth's sister-in-law, Carol Tinning, didn't believe the story. She knew that Marybeth was not above making up stories. Then weeks later, Marybeth and Joe moved away from Mount Pleasant and rented a ground-floor apartment in the Bellevue section of Schenectady. This was only a mile away from their old place, but it was a fresh start with new neighbors. So maybe they got tired of all the suspiciousness from the neighbors?
I'm sure. And then there was the other story Marybeth told about when she put Barbara to bed that night before she died, that Barbara told her she was going to go see her brother. And people think that she was just doing this for drama and attention. It's really twisted.
Very twisted.
So in July, Marybeth called the Department of Social Services, and she did a remarkable thing. She applied to be a foster mother, now that all her children were dead. And Marybeth and Joe told the social worker all about their losses. They said their baby died of cancer, and that's what Marybeth usually called Jennifer's death, was cancer. And the older 2 ones died of Reye's syndrome. Marybeth talked about their emotional need to fill the gap and how much love they had to give a foster child. And they requested a child between 5 and 10 years old. Marybeth seemed very sincere. She said that she considered working full-time after her last child died, but she would prefer to stay home and to be a mother. And part of this whole picture is that the social worker had a lot of sympathy for Marybeth.
Well, sure. If you knew nothing other than what Marybeth is telling you, you got to feel sympathy for her.
I would have a little tinge of skepticism as well.
She's lost 3 kids. Tragically.
And mysteriously.
Well, maybe not to the social worker. I mean, again, she's just listening to what Marybeth has to say.
You're right, yep. And she bought into it, so.
She certainly did. So the report from the social worker described Marybeth as a very warm, outgoing woman who was not yet ready to adopt, but who had a determined attitude about having a family. The social worker expressed concern that the Tinnings might be hurt by having to give up a foster child at a future date, but she wrote nothing about how a child might do in the home, which had been recently ravaged by such grief. And Marybeth was also taking tranquilizers on a daily basis. So somehow the social worker's report was all positive.
Yes.
No negatives.
Yeah, really no negatives.
Except for the mild concern about having to give up the foster child.
Which you'd say about any caring parents, I would think.
Sure.
The Tinnings' church pastor and several friends gave Marybeth and Joe glowing references also, and they were approved as foster parents. In the fall of 1972, they took in a little boy named Robert. Robert was with them for such a short time that none of their family or friends ever even met him. Then they were given a girl of 10 to care for. And friends and family said that Joe really became attached to the little girl. She reminded him of Barbara. Now, he wasn't one to talk much about his feelings, but he seemed to have the hardest time with the loss of Barbara. Maybe because she'd lived the longest, she'd lived to be, a real person that was up doing things and talking. And
yeah, almost 5, as you said.
Yeah. The social services caseworker regarded Marybeth as very emotionally strong. In 1972, caseworkers were not required to have any formal training in that area. All they needed was a college degree and any kind of willingness to learn on the job. The one who interviewed Marybeth seemed to have an admiration for Marybeth, for what she'd suffered through, and they think that might have clouded her objectivity in the case.
Well, certainly. I mean, if you look at it, again, in hindsight, but even if you want to be sympathetic to this woman who's lost 3 kids, as you said, there's got to be at least a tinge of concern.
If not for her being responsible of the children's deaths, at least for her mental stability at this point in raising another child.
Yeah.
Yeah, I would think so.
So, but anyway, this social worker let things slide, I guess.
Well, and all these other family and friends that knew stuff gave them glowing references, so
they did.
There's some responsibility there as well.
Now, early in 1973, Marybeth was 30 years old, and she became pregnant for the 4th time. She immediately lost interest in the foster daughter and insisted that she be sent back to the state care. A note in the file read, due to a physical condition of the foster mother, it was decided that this home would be closed. So that was it for her days as a foster mother.
Yeah, it's pretty harsh for the 10-year-old girl, don't you think?
Wouldn't it be?
Why wouldn't you keep the 10-year-old girl?
She couldn't have been that difficult.
There's no sign that she was difficult at all.
No.
But she was working part-time as a waitress at that time at a restaurant called Flavorland, and the other waitresses there gave her a baby shower. She'd given away all of her other children's belongings, which seemed understandable. This is something she would continue to do, though, right after each death, kind of a pattern. Even before the funeral was planned, the child's clothing was washed and packed away along with their furniture. And every time she began a new pregnancy, she'd go out all happily and eagerly shopping for new baby things like she was a first-time mom again. Weird behavior.
Just a bit.
For the birth of her 4th child, Marybeth made an appointment with Dr. Grace Jorgensen, a new obstetrician, and she planned to give birth at Bellevue Hospital. They had a fashionable maternity unit on the outskirts of Schenectady. Her former OB, Dr. August Schwank, had refused to care for her anymore. He would later say that he believed she was killing her children, but he didn't confront her. He said because he had no proof. He said he had spoken with several pediatricians who believed that something was very wrong, but none of them had any solid proof. So nothing was done.
No.
What do you think of that?
Well,
what if you have that suspicion? Is there something they could have done?
Well, I think these days it's easier. If you have any suspicion at all, you have to make a report, have it investigated.
Mm-hmm.
40 years ago, there was a lot more gray area. that probably things got slid by. And it's interesting that her OB didn't want to care for her anymore and came to say later on, and I don't know if later on means this was after she was convicted or not, because it's easy to hop on the bandwagon at that point.
I know, exactly.
But he thought she was killing her children.
It's quite a statement to make.
Now, if you're thinking that, even though it's in the early 70s, it still would be something I might report, right?
Absolutely.
But it wasn't.
No.
So baby Timothy was born November 21st, 1973. This was a quick, uncomplicated vaginal delivery. He was full term, but small. He weighed only 5 pounds 9 ounces. He also became slightly jaundiced. Now, Marybeth was advised to leave him in the hospital for treatment for a few days, but she rejected the advice and took him home in 48 hours. So despite the mild jaundice, Timothy had a good exam. It was a healthy, beautiful baby. Carol Tinning thought that Timothy looked just like her husband, Joe's brother Andy. For years after, she would say that Timothy was her favorite of Marybeth's babies.
So this had to affect everybody psychologically that saw these babies coming and going into their lives. Extended family, neighbors, anyone who had any interaction.
Well, absolutely.
Yeah.
And maybe not early, although I think it'd be tough to have normal relationship with her after the deaths of the first 3 so quick after each other.
Yeah.
But certainly as the numbers of deaths increases, you got to be more and more suspicious.
And people were. People would get more suspicious as time went on.
Yeah, but nothing happened.
No. Carol was just about to marry Andy when Timothy was born, and she was divorced and she had a son with some pretty severe cerebral palsy. The sudden deaths of Marybeth's babies was one of the big reasons why she and Andy never tried to have their own child, because they were believing that there was a genetic problem in the family, and they were afraid to have a baby that might end up dying like Marybeth's children were. But Marybeth again seemed really proud of her new baby, Timothy. She dressed him in a blue knitted suit and a bonnet and showed him off at the restaurant. On December 10th, Marybeth took him to the ER at Ellis Hospital, and Timothy was already dead.
And this was before he was even 3 weeks old.
Amazing.
Right.
She said she found him like that in his crib. A doctor who knew nothing of the family's history certified his cause of death as SIDS. This was the 3rd Tinning child to be brought in dead or dying to Ellis Hospital in less than 2 years. Now, think about that. That's crazy.
That would open up some doors of suspicion, wouldn't it?
Absolutely. It should have raised some concern. Even, I don't care if it's the 70s, it should have raised some concern. But there was no official investigation. One emergency room nurse reported to a doctor that she suspected Marybeth of killing these children, and allegedly the doctor told her to mind her own business. Now, it's remarkable to think about this, but at the time, nurses had to report any suspicions to a doctor first. They weren't allowed to make a direct report to child services without a physician.
That's how it was.
Crazy.
And actually, these days, it's probably our nursing staff that makes more reports than the physicians.
Well, the nurses spend so much more time
right.
with the patients.
They really get more and more involved with the patients, and they're the ones that get first suspicions.
Mm-hmm.
So, but yeah, 40 years ago.
So talk about a patriarchy.
That's right.
First, you have to go to the man before you can do anything about it, because he's in charge.
Absolutely.
Crazy. Now, Timothy was the first Tinning child whose death was reported to the medical examiner. The medical examiner failed to pass on the report to his superior, though, so it ended up that no autopsy was performed. So here we see another hole that child slid through, right?
Yeah. I mean, it gets reported, probably appropriately, to the medical examiner, but he fails to follow through. So no autopsy.
No autopsy.
So we have 4 dead Tinning kids. There's only one of them that had an autopsy performed. And
The older girl.
Barbara.
Yeah.
The other 3 had no autopsy.
Well, Jennifer's death was pretty clear.
Jennifer, the newborn, that was pretty clear. I can let them slide on that. But the other 2 are unexplained deaths.
Yes.
I would think you'd want to do an autopsy, but nothing happened.
No.
So Carol Tinning was very disturbed by Timothy's funeral. Marybeth was dry-eyed, she would say. She didn't seem the least bit sad and seemed to be enjoying the attention. When they went back to her home after the service, Marybeth was walking around calmly offering food and drinks. Seemed like there was a party going on. Now, Carol, for her part, spent an hour in the bathroom crying.
Yeah, she would say her husband had to find her in the bathroom and take her home. She was just a mess.
But Marybeth was reveling in it.
Seemed to be,
You know,
yeah. But even before Timothy died, there were things about Marybeth, of course, that troubled Carol. She had just met Marybeth when she asked if she could take Joel, her handicapped son, on a shopping trip to the mall. So Joel was 12, and he was walking with braces, but with quite a bit of difficulty. And when Marybeth brought Joel home from their shopping trip, she told Carol that she had been stopped by 3 separate strangers in the mall, all who assumed that she was Joel's mom, and all who said to her some version of how wonderful she was to keep him at home, considering what bad shape he was in.
So Carol thought this was pretty unlikely. Now, nobody had ever made a comment like that to her since Joel was born. And here Marybeth comes home and says, 3 people were complimenting me.
Right.
Then we have some other kind of strange happenings with Marybeth. Carol invited Joe and Marybeth over for cards one evening. Now, the 2 women left their purses side by side on the stairs as the couples played cards. Carol knew she had exactly $40 in her purse. She remembered that exactly because money was tight, and she was planning to go grocery shopping. So when she went to buy the groceries the next day, the money was gone, and she suspected that Marybeth had stolen it.
Well, sure, I could see what else would happen to it. And she already knows that Marybeth's a little bit weird.
Yeah, she's already got kind of the bad vibes about Marybeth.
Absolutely.
So she confronted Marybeth, who denied it, and blamed Carol's teenage daughter.
Yeah, Carol had a teenage daughter and a 12-year-old son from her previous marriage.
Then there was another incident of missing money around Marybeth. In May of 1974, she reported to police that her home had been burglarized. Marybeth was the treasurer of husband Joe's bowling club, and she claimed that the club's funds, a few $100s in cash, had been stolen from their home. Also, Joe's bowling ball and some of his bowling shirts were missing, as well as some small jewelry items. The apartment had been trashed, but there was no signs of forced entry. The bowling items were later found in a quiet neighborhood about a mile away, and the money was never found. Marybeth was interviewed, and the police assumed that Marybeth had staged the burglary to cover up her theft of the bowling club funds. But nothing further came of that.
Well, what else is going to come of it?
Well, the bowling club didn't prosecute her, did they?
No.
So,
she's Joe's wife.
Yeah.
Now, Marybeth and Joe fought about money quite a bit. Joe would hide his checkbook from her because she'd steal checks from the back of the book and write checks to buy things, because back then, wasn't unusual to take your checkbook to the store to buy things. And she shopped compulsively and had clothing in her closet which had never been worn and still had tags on them. Some of her spending money came from the insurance checks, which were paid out after each child died. This was more than what was needed for the funeral expenses, but Marybeth seemed to believe that this money was hers to spend. She had a pattern of spending the insurance money while Joe paid for the funerals out of his paychecks. After the 5th death, an acquaintance remembers Marybeth telling her, "We just got the check for Nathan, so I'm going out to buy new drapes and wallpaper." How creepy is that?
Yuck.
Yuck, yeah. Several sets of neighbors remembered Marybeth and Joe having loud arguments they could hear. In the spring of 1974, they argued about Carol's missing $40 and the negative effect it was having on his relationship with his brother Andy. Those 2 brothers had been kind of in and out and having a hard time being friendly, and after this happened, it really put a wedge in the brothers' relationship. But no one knows what Joe said to her about the bowling funds. One day, Joe told Andy that lately his food had been tasting bitter. Andy advised Joe to take his next home-cooked meal to the laboratory and get it analyzed, but Joe just kind of laughed at that and shrugged it off.
Yeah, but Andy was serious.
Absolutely he was.
And he and Carol were getting more and more suspicious of Marybeth's actions. And that was not a joke, that he told Joe to get the food tested, but I guess Joe said, "Yeah, Right.
You know, Joe is one of the most passive characters I've ever heard of.
So one day, Carol asked Joe, or Marybeth, one of the two, to pick up her son Joel's Phenobarbital prescription. This was the child with cerebral palsy who had a seizure disorder.
Mm-hmm.
And she would pick up the pills from the Tinning's house the next day. But around 3 o'clock in the morning, Carol was awakened by the phone ringing, and it was Marybeth. "Joe's dead," Marybeth cried into the phone. Carol and Andy drove like mad to their house and found Joe unconscious on the floor. His face was bluish purple, and the sheets were wound around him as if he had fallen out of the bed. Marybeth stood in the corner repeating, "I didn't do it, I didn't do it." Marybeth was fully dressed, but she hadn't called the police or an ambulance.
So how many things are wrong with this picture?
Well, just a few.
Yeah. Andy did CPR on Joe while Carol called 911, two things that Marybeth hadn't done. They got to Ellis Hospital and they were able to save Joe. He had ingested a lethal dose of phenobarbital, and they would find that Joel's prescription bottle, which had over 70 pills, was empty. Andy told the doctor that Joe had been complaining of his food tasting bitter, but Joe decided he didn't want to press charges. He chose to accept the stigma of this being a suicide attempt rather than accuse Marybeth, and he went back and returned to living with Marybeth. He told his brother that if he did nothing to upset Marybeth, it was likely that it wouldn't happen again.
That just boggles my mind.
Doesn't it? I think Joe has some kind of issue as well.
I think so. I mean, your wife's tried to poison you. There's probably no doubt in his mind who is responsible for that. And yet,
Well, no. How could there be?
Yet he chose to live with her.
He did. Didn't want to rock the boat.
Wow.
Plus, he has all these dead children. And you think at some point it would come to his head that something's wrong here. I mean, people were begging him to get a vasectomy, at least to stop her from having more children.
Right. But he didn't do that. Did
No.
he?
Nope.
So after Timothy's death, Marybeth had returned to Flavorland and worked more hours. Now, her fellow employees said she worked hard, but she could be snappy and impatient, sometimes with customers. Marybeth was very strange in that she never seemed to look anyone in the eye. During breaks, she sat alone in the lunchroom reading. She became particularly fascinated with a book by Mary Higgins Clark titled Where Are the Children? We've read that. Or I've read that.
You've read it. I don't think I have.
I read a lot of Mary Higgins Clark.
Yeah, you like those mysteries.
This is a story about a woman whose children disappear and an unsolved murder of her other children, which results in an investigation of the woman for killing her children. Well, quite apropos, don't you think?
Yes, and she had this book a lot. It wasn't like she just had it for a week reading it. It's like something she went back to, like her favorite book. One older waitress who worked with Marybeth remembered one day when she learned that Marybeth was pregnant again after Timothy had died. Marybeth leaned in and whispered to her, "God told me to kill this one too." She said that Marybeth had a glassy, distant expression on her face, and that she often seemed to be in a trance. The waitresses, though, they just talked about it and decided that they thought her losing so many children had made her kind of crazy. Marybeth had her fifth child, Nathan, on Easter Sunday, March 30th, 1975, and she brought him into the restaurant to show the other waitresses. The older waitress was nervous because of what Marybeth had said to her before. So she said, "Maybe his being born on Easter Sunday is an omen, Marybeth, that nothing will happen to him." Trying to be hopeful, I guess. Put out that suggestion to her.
Didn't work. She was wrong. Nathan died suddenly when he was just 5 months old. Marybeth drove up to the Flavorland restaurant yelling for help with Nathan. So this time she didn't even go to the ER or anything.
No, this was very odd.
Her fellow employees ran out to the car where they found Nathan strapped into his car seat, blue and still. They called for help and the ambulance came, and he was rushed to St. Clair's Hospital. And no one could understand why Marybeth drove to the restaurant instead of the hospital, or stopping somewhere closer to call for help.
Yeah, it's almost like she wanted the waitresses to see it.
Yeah.
Yeah. He was blue and lifeless when he was brought into the hospital, and he was put on life support, but he was already brain dead. Marybeth told a story about Nathan being in the car when he made a gurgling sound and he stopped breathing. Now, after thinking about it and going over the details, it's more likely that Marybeth suffocated Nathan at home and then put him in the car and drove to Flavorland. After his birth, Nathan was sent home with an apnea monitor because if he stopped breathing at home, she'd be able to find him and, start CPR. And the thing about that was she would be expected to find him. So by having him in the car, that kind of gave her an excuse for him being dead by the time she got him to help.
Well, yeah, and that's still making the assumption that the apnea monitors did what they're supposed to do, which they don't.
Sure, but don't you think that would be a reason why she would take him away from the home for the incident?
Sure. Yeah, because he's sent home on an apnea monitor, and Marybeth is told that if he stops breathing, the alarm will go off. And so by doing what she did, she bypassed that.
Yeah, and I know apnea monitors are really not the thing to do, but I think that would be a good reason why she used this technique.
Yeah, I think by her way of thinking, this is the way to bypass that.
Yeah, exactly.
So Nathan's death was also reported to Schenectady's medical examiner, but this time an autopsy was performed. It was done at St. Clair's. Now, he was found to have no congenital anomalies, and the pathologist determined that the cause of death was acute pulmonary edema. Now, this just means that his lungs were congested, and there's a lot of reasons for lungs to be congested, including suffocation. So all the pathologist said was, basically, I don't know why the infant died, but he had congested lungs, pulmonary edema. And apparently the pathologist wasn't familiar with their family history. And the postmortem examination certainly did not explain why a healthy baby would suddenly die.
So by the time Nathan died, the Schenectady Gazette obituaries had become a morbid curiosity. People were actually wondering when the next Tinning baby would die.
Well, we're at 5 now, right?
Yeah. During Marybeth's pregnancy with Nathan, she and Joe moved to a new apartment. Their landlord, Charles Reye, was a mailman who knew Marybeth from the restaurant. Charles and his wife really loved children. They visited Marybeth after Nathan was born, and they were there to offer support to the couple after Nathan died. Joe and Marybeth applied with a private adoption agency in 1978. As they waited for their new baby to arrive, Marybeth became pregnant. But she didn't back out of the adoption, surprising some people. Within 3 months, she became a mother 2 times. Michael, her adopted child, was born on August 3, 1978, and her daughter, Mary Frances, was born on October 29th. Mary Frances was another blonde baby. Michael was olive-skinned with black curly hair, and both babies were beautiful, healthy babies. She took the babies to Flavorland to be admired, and she seemed happy, and the babies seemed well taken care of and content. Then, on January 20th, 1979, tragedy struck again. Marybeth rushed to St. Clair's ER with a limp Mary Frances. She told the familiar story of finding her unresponsive infant in the crib. The emergency room staff was able to resuscitate Mary Frances. She was 3 months old, and this was an age that is pretty common for SIDS. Doctors and nurses were divided on their opinions of what had happened to Mary Frances. Some were suspicious of Marybeth. Others thought there must be a genetic issue in the family. In Marybeth's favor was the support of her pediatrician. He was one of the most respected physicians in the region, and he believed in her innocence. Her children always seemed happy and well cared for when they came for their visits. Dr. Melly was frustrated by his inability to diagnose the cause of the Tinning children's death. While Mary Frances was hospitalized, Marybeth stayed around the pediatric ward. She slept on a cot at her baby's bedside. Dr. Mealy was concerned about Mary Frances's suffering the same fate as her siblings, and he decided to have her examined by pediatric specialists at Boston Children's Hospital. So it seems like this doctor was just so worried about these kids, but for some reason would not consider that Marybeth was doing anything.
It appears that way.
Yeah.
I mean, geez, we've had 5 dead children and now a near-miss death in the 6th kid. I can see where he'd want to have some further evaluation, but at the same time, you got to be suspicious.
Yeah, I think he would at least keep the kid away from her.
Yeah.
Mary Frances was kept there for several days while chromosomal studies were done, as well as x-rays, cardiac, and blood tests, and all of her results were normal. Boston doctors recommended that Mary Frances go home with an apnea monitor, so Mary Beth took her home.
Now, on February 20th, 1979, which was exactly 1 month after she was first admitted to St. Clair's, Mary Frances was brought back in full cardiac arrest. Mary Beth said that she had fed the baby around 6:30 in the morning and then put her back in the crib. An hour later, she heard the apnea monitor's alarm and found Mary Frances unconscious. Now, this time, doctors could not save her. Mary Frances had irreversible brain damage. She was put on a respirator, sent to the intensive care unit. Nurses who had recently cared for the baby were heartbroken. There were a lot of questions going around that hospital.
It was a 5-minute trip from Mary Beth's apartment to St. Clair's, so Ellis Hospital was closer to their most recent apartment. Mary Beth had not returned to Ellis because she felt more comfortable at St. Clair's. An Ellis employee had told her to have her tubes tied before she filled up the cemetery with her children, and she knew that the Catholic hospital would never tell her anything like that. Since Mary Frances had no brain activity, the Catholic doctrine permitted her to be removed from life support. Mary Frances underwent more testing and an autopsy was done. The chief of pediatrics, Dr. Alan Lobovitz, wrote out a summary of the case that included his suspicions that Mary Frances may not have died from natural causes. No anatomic cause of death could be determined, and SIDS ended up being what was written on the death certificate. They said there were no signs of abuse. When Mary Frances was born, Mary Beth had said that this would be her last child. She told friends and relatives that she had a tubal ligation. St. Clair's didn't allow this procedure, so she said she had it done at Bellevue. Little Michael, the adopted child, was thriving. He was a lovable, extroverted baby, 6.5 months old, when Mary Frances died. The waitresses at Flavorland, as well as the Tinnings' neighbors, loved Michael. He was such a little charmer. As he got older, it became clear that he was an African-American baby, but Mary Beth continued to insist that he was Italian. The landlord, Charles Reye, adored Michael. He believed that Michael was safe because he wasn't genetically related to all of the dead Tinning children.
Now, Mary Beth conceived again just a month after Mary Frances's death. So if she had really been sterilized, this was going to be one of those rare cases where tubal ligation failed. And that was her story. She'd had her tubes tied, and somehow she got pregnant. Now, she gave a couple different versions of this story, though. In one, she said that it was a male obstetrician who performed her surgery, and he invited her to have this one on me, meaning that he would waive his fee for the delivery.
That sounds so stupid.
That's just beyond belief.
That's stupid, yeah.
Now, in another version, it was a woman obstetrician who did the useless procedure. According to Mary Beth, this doctor took her out to lunch and promised to forgive an outstanding bill if she would have her tubes tied after this delivery. Now, neither of these stories were supported by the doctors. According to the male OB, Mary Beth showed up for her appointment to discuss a tubal, but she left after she was told there was a long wait.
So she didn't really want to have it done, obviously.
No, and it's apparent that she lied about it.
Yeah. The Flavorland waitresses were really upset to see her pregnant again. Some of them were angry with her for lying about the tubal. She'd repeatedly told them that there was a genetic problem, so why was she continuing to have babies? It seemed to be the one thing she was good at, as she had uncomplicated deliveries and her babies were beautiful. And she also enjoyed being at the center of attention and at the center of this medical mystery. She gave birth to her 7th child, Jonathan, at St. Clair's on November 19, 1979. He was 1 month premature and weighed just under 5 pounds. Jonathan had 2 umbilical blood vessels instead of 3, which is associated with an abnormality of the kidneys.
Well, can be.
Well, you tell us about him.
He had a 2-vessel cord, which can be associated with kidney abnormalities. His testicles were undescended, and he had a condition called hypospadias, which is where the opening at the tip of the penis is moved towards the underside. So these things are all considered kind of minor malformations, but we were always taught that the more minor malformations, the more likely there is a major malformation. So this would warrant a little bit of an evaluation. And also because he is a premature infant, and maybe even more so because he was a tinning, the nurses were extra attentive of him. So Jonathan was kept in the hospital for a week or two after Marybeth was discharged. Dr. Melly suspected that Jonathan's birth defects might give him some insight into the family's problems, and he was determined to prevent a recurrence. So he's still looking for an inherited metabolic disorder. He looked through the Tinning children's medical records.
So one thing that he did look at, like you'd mentioned earlier, was that most of the children did have high ammonia levels in their blood, close to the time of their deaths. But one big problem with the genetic theory is that children with these inborn errors in the urea cycle are sickly from birth.
They get sick within a few days as soon as you start feeding them and you get protein intake. They get sick. And these were healthy kids. And the other thing, you have to be handling the blood for the ammonia level in a certain way. You can't just draw it and have it run. Otherwise, it gives you a result that's not credible. I would look at these high ammonia levels, or what seem to be high ammonia levels, with suspicion.
Or you'd kind of disregard them.
Right, because it was clear that they didn't suffer from any inborn metabolic error.
No, they gained weight.
Yeah.
They were healthy. The first health crisis with Jonathan was nearly identical to that of Mary Frances. Marybeth brought him to the St. Clair's emergency room, and he was unconscious. The nurses cringed when they saw her, as you can imagine. It was becoming really difficult for them to deal with her, and they themselves were becoming traumatized by these children's deaths. Jonathan was able to be stabilized, but he was rushed to Boston Children's Hospital to have extensive studies and observation. And in Boston, he did go through some extensive testing, and all of the findings were normal. His birth defects were determined to be unrelated and correctable with routine surgery, and he was described as an active, wiggly little baby. So he was sent home with an apnea monitor as well. You have anything to say about that?
The apnea monitor?
No, everything. Boston, everything that happened in Boston.
Well, I would imagine he had a very thorough workup, seen by multiple specialists, and they found nothing. So I think that you could safely say he didn't have any metabolic disorder, and he didn't have Reye syndrome.
So if he went to Boston Children's in 2018, don't you think that there would be a study of the mother for Munchausen syndrome?
There would be
psychological studies?
There would be a more thorough evaluation of the mother.
Yeah.
Absolutely.
For sure.
With that history.
I think so too.
And they would know the history. Even if Marybeth was not forthcoming with the history, the referring hospital would. So they would have known.
Mm-hmm. I think they did.
So 3 days after Jonathan went home, Marybeth took him back to St. Clair's emergency room. And just as in Mary Frances's second visit, Jonathan was irreversibly brain damaged.
Don't you think if you were one of the nurses in that hospital, you just want to hit her at this point and say, you motherfucker, you're killing these babies. Absolutely.
Yeah, doctors and staff were more concerned than ever that Marybeth was doing something to harm her children.
And rightly so.
However, some still believed there was a genetic problem, and this was despite all the negative testing and research.
So they're giving her way too much benefit of the doubt.
Yeah, and there's no way to prove either hypothesis.
Well, I think the way to prove it is to take the children out of her custody and see how they do.
Sure.
That's a little more difficult because with some Munchausen by proxy cases, or most of them, I think, you can correct me if I'm wrong, the children have ongoing health issues, like they can't eat, things that the mother reports. But these babies, she never said they were really sick for a long time.
No, it was all acute illnesses.
Yeah. So it would make it a little more difficult because usually they can tell that a child's well pretty quickly when they take a child away from a mother who's making the child repeatedly ill. But she's just killing them quite quickly.
She is. And not even in very imaginative ways.
No. No.
She just follows the same pattern.
Yes.
So Jonathan was transferred to Albany Medical Center to be on life support in the pediatric ICU. Now, doctors in Albany had Jonathan checked by several experts, and they made a hotline report to social services for suspected abuse or neglect. Like Boston, Albany did not think Jonathan's birth defects played any role at all in his death.
Marybeth was tearful and panicky the first day, but after that she seemed really calm and unemotional again. Whenever a sympathetic nurse would sit with her, She would tell that nurse the story of how friends and family had abandoned her because they suspected her of killing her children. So that's another weird thing, is she keeps bringing up that people blame her for killing her children, which is really pretty weird.
Very.
As she sat at Jonathan's bedside, she had a new strange topic that she was bringing up now. She really shocked the medical staff by telling them that she would love to have a career as a mortician.
Just gets weirder and weirder.
That just floors me. And to just even consider a mother telling me that floors me. Not that being a mortician's a bad thing. I'm just saying in this circumstance, holy shit. It's like she kind of likes funerals is what the vibe I get from that.
Yeah.
Yeah.
Well, she likes being the center of attention.
That too.
So Jonathan died on March 24th, 1980. His and Mary Frances's short lives had a lot in common. Jonathan had been conceived right after Mary Frances had died. Both were born in the fall, did well until Christmas, and then became ill in the new year, and neither survived until spring. Both were taken in for 2 ER trips to St. Clair's. Both times they appeared to recover at the first visit and went into comas just days after returning home. And in both cases, the second crisis event ended in their death. Now, an autopsy was performed on Jonathan, and Albany's pathologist had no access to any reports on other Tinning children because they were filed in a different county. And for the same reason, the Schenectady medical examiner wouldn't see the Albany pathologist's report either. So they were only like 15 minutes apart, but there was no communication between the two coroners' office. Finding no obvious cause of death, Jonathan's death was labeled undetermined. He was listed as having died of cardiopulmonary arrest, which simply meant that his heart and lungs had stopped working.
The fact that Michael was adopted seemed to protect him from the same fate as his siblings. As long as he survived, Marybeth could use the genetic factor as a reason for these children's sudden deaths. For this, those who suspected Marybeth were thankful, and they were hopeful that she wouldn't dare kill Michael. When Michael was 2.5, he had an accident, and Marybeth explained that he fell the length of the steep back stairs in their apartment. She said that he had heard the mailman and was anxious to greet him. Michael's head was bruised and he had a cut. He was taken to the hospital and a small dressing was applied to his forehead. And he may have had a mild concussion. A caseworker from Child Protective Services visited the home but found no evidence of abuse. Michael was dizzy and had some vomiting and apparent headaches, and after a few days he seemed better and more energetic. And that Sunday he visited his grandparents and seemed to have a normal, happy day.
Yeah, but at 7:30 the next morning, Marybeth called her sister-in-law Sandy Rowe. She sounded panicky as she told Sandy that she couldn't wake Michael. Sandy told her to take him to St. Clair's ER immediately. But instead of doing that, she called Dr. Millie's office. The practice had 10 o'clock every weekday free to see children who had gotten sick overnight, kind of a walk-in clinic type of thing.
Mm-hmm.
So Marybeth was told to bring Michael in at 10 o'clock for what they called sick hour. Now, if she said that it was an emergency, she would have been told to go to the ER. Instead, she waited over 2 hours for the doctor's appointment. So the pediatric office was a 10-minute drive from her apartment, while St. Clair's was so close that she could walk over. 2 weeks earlier, when Michael had fallen, she called an ambulance. Now, totally different situation. He's unresponsive, and yet she waits for an office appointment.
So this makes no sense.
None.
It was about 9:45 when the nurse heard the front door open and saw Marybeth standing inside the door with Michael wrapped in a blanket, and Marybeth was yelling, "We need help." So this nurse hadn't suspected Marybeth before. She was on the side with the doctor, thinking it was a genetic thing. But she knew something was really wrong. She grabbed Michael and laid him on a little wooden bench where the children usually sat, and as soon as she unwrapped him to look at him, Marybeth started running around the room and yelling hysterically. It was very strange. The nurse started CPR and dialed the operator for help, and the paramedics arrived in minutes. The pediatric staff knew where Marybeth lived. She lived across the street from the hospital. So they asked her why she came to the office. She said she had talked to the doctor earlier that morning, and he told her to bring him in at 10. On the way to the office, she said she heard Michael gurgling. Now, when Michael was there, he was already dead. And this death broke a lot of hearts. He was over 2 years old, and many people knew him very well. Michael's autopsy would show that he had acute pneumonia, and after that finding, the inquiry into Michael's death was closed. But most of the community now had a very similar opinion. After each baby's death, their suspicions grew, but after Michael died, they knew Marybeth was responsible for all of them. Many called the child abuse hotline, the welfare department, and even the sheriff's office. So do you want to talk a little bit about this pneumonia diagnosis, which is really lame?
It is. And I don't know if he wanted to give Marybeth the benefit of the doubt or what. But anyway, this diagnosis of pneumonia was made with great reluctance by the chief of pathology at the hospital. He found it difficult to believe that a mother would kill her own children for no apparent reason. He was able to rule out brain injury from Michael's fall as a cause of death. He still had a bruise and probably had suffered a mild concussion, but there was no evidence at all of brain damage. The only unusual finding was a small patch of pneumonia in one lung. Now, when you looked at it under the microscope, this condition was way too mild to have killed a healthy kid. But it wasn't a case that could be won in court. I mean, even if you charged her with his murder, all you have to do is bring up the pneumonia question.
For reasonable doubt.
For reasonable doubt. And off she gets.
But let's just talk about all these kids in the SIDS. What is SIDS? It's not a medical diagnosis. I'm kind of confused about it. What is it?
Well, it's a confusing syndrome, okay?
Yeah.
It's basically an unexplained death in an otherwise healthy child. So that doesn't answer the question, does it?
Well, what about explanations that it's something with the brainstem that stops telling the kid to breathe?
Well, there's a lot of research into it. And the theory at this point is that there's some underlying pathology that makes the child have chronic asphyxia, chronic anoxia, so they're underoxygenated, which would be a brainstem problem. And then, so you have a child at risk, and then you factor in other things. So maternal smoking during pregnancy, after pregnancy, smoking.
So that's proven.
That's proven. Prematurity. The biggest thing that's played a role, a significant role, is the sleep position. So up until a few years ago, well, more than a few now, babies...
Well, yeah, I think 20 years. It's been a while.
Right, it's been a while. But babies were placed prone in the crib.
On their bellies.
So they're face down. And there's a big association between prone position and SIDS. So the Academy of Pediatrics started a back-to-sleep program where infants are put on their backs to sleep. And the incidence of SIDS has decreased dramatically. So there's still other things that could be involved, but it appears that there's babies at risk, and then there's smokers, there's prematurity, there's poor living conditions, there's sleep positioning, there's other things that factor in.
What about sleeping with parents? That must be bad.
Co-sleeping is bad.
Yeah.
It's not recommended.
Well, anything where their face can get squished away from air, I mean, that's just common sense.
It is.
Remember how we used to have the bumper pads and the big quilts and everything? So that's all out.
That's all out. So males are more affected than females. I'll just run through a few other things.
Okay, yeah, that'd be great.
More happening, more SIDS during the winter season than the summer. Any recent illness with fever. Pacifier use is associated with better outcomes, a reason to do passies. If they're not growing well, they're more likely to be SIDS. So there's a host of things that are associated with it, but it's still not a well-understood syndrome.
So how do we know if a baby dies of SIDS or if the mom suffocates the baby? That's the big question.
We don't. Oftentimes, it's very, very difficult. So you'd want to see signs that the baby was suffocated.
Like what?
Like hemorrhages, petechial hemorrhages, or an older kid that struggled, bruising. But you don't often get that.
And what about the blue color? I was reading a book by a pathologist who said that babies that die of SIDS aren't blue. Is that true?
Yeah.
So there's a big one. Her babies were blue.
So, yeah, blue would indicate that their airways had been cut off. And SIDS it would be kind of a peaceful death, I guess, if you could say that they just stop breathing.
Huh. So why aren't they blue if they stop breathing? I mean, my understanding is if you don't have oxygen, you're cyanotic, you're blue.
Well, it's more of a gradual process. And in kids that are suffocated, it's an acute thing.
And that's what it makes the blue color?
You can't rely on that. It's not, if you're blue, it means you were suffocated, and if you're pale, it means you were SIDS. You can't just simply say that.
So it's not that black and white?
No.
Okay. Well, this pathologist that did the examination of Michael, my impression was that he almost felt like, shit, there's this little pneumonia. He thinks the mom killed him, but this little bit of pneumonia is that little bit of doubt that makes them feel like they can't take her to court on it.
I think so. Because the defense could easily argue that the pneumonia had caused Michael's death, and there wasn't enough evidence to prove that it didn't.
Exactly.
So you're stuck.
Well, a week after Michael's death, Marybeth went to Dr. Mealy's office and insisted on speaking to the doctor and the nurse that were there when she brought Michael in. She told the two of them that some people had been criticizing her decision to bring Michael to the office instead of going directly to the hospital. Well, yeah, right? She wanted to explain why she had waited and come to the office, which I don't accept any explanation for that.
No.
But she said it was because the pediatricians in the practice told her to. So that's interesting, right? Because people call you when you're on call and you tell them whether to go to the office or go to the hospital. What if they don't listen to you and something bad happens? She's kind of in this situation where she's saying one thing, they're saying another. So it's really one person's word against another.
Well, these days we take notes of telephone encounters. And my electronic medical record allows me to use a phone app. So when I speak to a patient, I can make a note on my phone that goes directly to the patient's chart.
Well, they didn't have that.
No, they didn't.
That's pretty neat.
So it's when I say, I think you should take your child to the ER for an evaluation, it's right there in the chart.
Okay, well, what she didn't mention when she called, though, was how serious his condition was, obviously, because no one in their right mind would tell her to wait for the appointment.
No.
And I think anyone would know that a doctor wouldn't tell her that, or a nurse or anybody. No professional would tell her.
We wouldn't do that.
Not even a neighbor would tell her. I mean, nobody with any common sense at all would tell her to wait for that appointment.
Yeah. I mean, you call the doctor's office, and if you say to them, my child's not breathing, you say, well, go to the hospital.
Or call 911. You don't even go to the hospital. You call 911 and do
Right.
CPR until they get there.
Exactly.
So just the fact that she would go into the hospital carrying her babies was ridiculous. She'd been through this so many times. She should have known. Start CPR, don't stop until the paramedics get there. That's common sense that she had and didn't use. So Michael's death, of course, not being her genetic child also, opened her up to a lot more suspicion. So this story of the death gene in the family, that's no longer valid.
There it goes.
After the funeral, all of Michael's toys and furniture were donated to the church nursery, and a few weeks later, the Tinnings moved to yet another neighborhood. So you think this would be the end of it, wouldn't you?
Well, there's more and more suspicion that she's causing harm to her children, so much that they have to move again to get away from all the bad publicity. But it didn't stop her.
No. In the 15 years since Joe and Marybeth had been married, they'd rented 4 apartments in Schenectady. And that was because she needed to get out of the neighborhoods, because people didn't like her anymore. Joe had a pretty decent job, but Marybeth was a spender, so they still hadn't bought a house. To help them save money to buy their own place, Edna Tinning invited them to live with them and save up some money. So Joe's parents, they lived in Duanesburg, where Marybeth had grown up. And after the move, she didn't keep in touch with her former neighbors. Once in a while, she visited Flavorland for coffee or to eat with Joe, but not very often. Investigations into Michael's death had ended already. Dr. Mealy's nurse, however, couldn't forget about that day. She was traumatized. I mean, she probably had PTSD. Every time she looked at the bench in the office where she still worked, the horror of Michael's death would come back to her. She couldn't sleep at night thinking about what she might have done to prevent this little boy's death. In Duanesburg, Marybeth volunteered for an ambulance service and then for a counseling organization. After being hired as a clerk at the counseling office, she began to tell stories and pass herself off as a professional counselor. She said that her losses allowed her to empathize with those who had lost a child. In one case, a couple had lost their little girl who had been hit by a car. Marybeth would tell people a story of visiting their home. She said they couldn't bear to change anything, and they still set a place for the little girl at their table. but Marybeth had talked to them and convinced them to clean up her room and get on with their lives, and she was proud of this. The volunteers that heard her stories, though, began to question the wisdom of someone like her counseling people in crisis. I mean, they could just tell as lay people she was not stable. She was this nervous, unbalanced woman who was kind of difficult just to be around.
And the director looked into this, and he found that Marybeth frequently went on nighttime missions to assist families in crisis. So she got fired and was warned not to visit the families again.
Well, during those 11 months while she was living with her in-laws, she became increasingly strange. She stole an expensive life-size model of an infant that was used by the ambulance service to teach CPR. Now, they couldn't prove that she was the thief, but everyone felt really sure it was her. Other equipment disappeared, and Marybeth was suspected. So there was this overall sense of relief when Marybeth and Joe moved out of Joe's parents' house and back to Schenectady. But they hadn't managed to save enough for a down payment on a house still, so they rented yet another apartment. Marybeth told their new landlord that they had no children, and it would only be her and Joe living at the apartment.
So Marybeth took a job as a school bus driver in September of 1984. She didn't tell her new co-workers about all of her dead children, but she would give little dribs and drabs, maybe one or two of them.
Just enough to get some attention, but
Right.
not suspicion.
Not suspicion. One day, she drove a group of preschoolers to a nursery school, and she was seen by Dr. Kevin Karpowitz. Now, Karpowitz was a Schenectady pediatrician who was very outspoken about child abuse. He, in turn, remembered Marybeth very well from her son Jonathan's death at Albany Medical Center. So he worked at the nursery school as a consultant, and seeing Marybeth responsible for the safety of children shocked him. The more shocking thing he noticed was that Marybeth appeared to be pregnant. She was going to have another baby, and he was powerless to do anything to protect that child.
So this time, Marybeth's pregnant for the 9th time. This is her 9th child. No, the 8th time because she adopted one. So this is her 8th pregnancy. And she seemed to have some mixed feelings about her pregnancy. At this point, she's 42 years old, and she waited till she was 5 months along before calling an OB for her first appointment. She cried when she told her landlord about the pregnancy, afraid that he would evict them, but of course he was very understanding and said no problem. Now, she was really worried when she called her sister-in-law Carol Tinning, and Carol told her that she better not let anything happen to this one. She acted as if she was afraid of losing this baby, but she seemed like she was actually afraid of what people would think of her. Her baby was due in August 1985. She worked for the bus company until the end of the school year in June, and a few days before her baby Tammy Lynn was born, the former waitress from Flavorland, who she'd talked to in the back room before, ran into her. And this was the waitress that Marybeth had said, "God told me to kill this one too."
That one.
Yep. So this waitress felt sick seeing Marybeth pregnant, but she would say that Marybeth just smiled and said, "Oh yeah, I can give birth any minute now."
You know, just hours before Marybeth killed her daughter Tammy Lynn, she had bought Christmas presents for her. She was with her neighbor Cynthia Walter, who had a baby of the same age. And they lived next door to each other, and both at the same stages of their pregnancy, and had become friendly. So Cynthia's first impression of Marybeth was that she seemed very nice. Soon she understood that Marybeth had led a troubled life. She said that her parents had abused and neglected her. As time went on, Marybeth shared stories of her infants who had died. So it was understandable to Cynthia that Marybeth would be afraid her baby would die, but it almost seemed like she was resolved to the fact that her baby wouldn't be around for long, and she wasn't.
No. She was born on August 22nd, and Marybeth seemed really happy with her, as she had with her others. She spent hours playing with her, put ribbons in her hair, dressed her up nicely, and Tammy Lynn was a normal, adorable baby. She was different than the other Tinning babies because she had a full head of dark hair. Now, Marybeth, of course, liked to go shopping, and she bought anything Tammy Lynn could possibly need. The new pediatrician, Dr. Ford, recommended that she use an apnea monitor, but Marybeth turned him down, saying it wasn't necessary. She said she'd had monitors for 2 of her other babies, but they hadn't worked. So I guess it's like, why bother? She took Tammy Lynn to all of her doctor checkups, and each time her physical exam found her to be normal, healthy, and thriving. Tammy Lynn's last doctor visit was on October 31st, 1985. Now, Cynthia noticed that Marybeth wasn't very confident as a mother. When Tammy Lynn cried, Marybeth would get very anxious and tense. She said that if she had been a better mother, her other babies wouldn't have died. Cynthia felt like she had to teach Marybeth basic infant care. She was appalled to learn that Marybeth was preparing 24 hours worth of formula in advance. And even worse, she was leaving it out on the counter until they were used. When she told Marybeth that the prepared formula should be refrigerated, Marybeth said they were fine and just kind of blew her off. Leaving them out meant that she didn't have to warm each one of them for each feeding. It saved her time. Marybeth also seemed unable to deal with Tammy Lynn's diaper rash. Her rash was quite severe. It was deep red and it never went away. Cynthia told Marybeth to apply Desitin cream to the rash, but she just seemed to plaster it on in random swipes, so it never healed. But still, Tammy Lynn was always well-dressed and looked clean and pretty happy. Cynthia visited the Tinning apartment on December 19, 1985, and would remember that the baby was in a good mood. She cooed and giggled as Cynthia held her and played with her, and Edna Tinning, Joe's mom, was there for a visit too. After Cynthia had held the baby for a few minutes, Marybeth said, "Give my baby back to me," in kind of a stern tone that she'd never used with her before. So Cynthia gave Tammy Lynn to Marybeth and left in a bit of a huff, feeling offended by this. So there are two versions of what happened later that evening. Both are Marybeth's.
In one version, her mother-in-law left her apartment about 9:30, and Marybeth settled into a recliner with Tammy in her lap. But Tammy Lynn was not as responsive as she had been earlier. She was fussy when she was offered the bottle. So after fussing and crying for half an hour, she fell asleep. Then Marybeth got herself ready for bed. In the long, narrow setup of the Tinning home, Tammy Lynn's room was as far from the master bedroom as it could be. Now, Marybeth hadn't made the room next to theirs into the nursery because she said all of Joe's stuff was in it. So at night, Tammy Lynn was completely out of earshot. So this is a little strange because several of her babies had died in their cribs. So wouldn't you think she'd want the baby next to her?
It seems neglectful and careless, even if she wasn't guilty of anything.
I know.
Yeah.
So Marybeth slept on the double bed until Joe came home around 11 o'clock. They talked for a few minutes before Joe got into bed and fell asleep. Joe had had a few drinks at the bowling alley, but he wasn't drunk. So after Joe was asleep, Marybeth said she was tossing and turning. She got up to watch TV in the living room. So after a while, she got sleepy again. She went to check on the baby before she went back to bed herself. So she found Tammy Lynn on her stomach, tangled in her blanket. Marybeth turned her over and noticed a spot of blood on her sheet, and she was very still. Marybeth realized she wasn't breathing. She screamed for Joe, called an ambulance, called Cynthia, and started CPR. But it was too late.
Well, those things are done out of order, for one thing. Whenever you take the CPR test, right? Start CPR is always the first thing you do.
And then you call for help.
I guess you could scream and then start it, but you don't call an ambulance and a friend.
No.
So it's too late. It's
Right.
just a tragedy. And when questioned by the police 7 weeks later, Marybeth tearfully did tell a different story. In this version, Marybeth was dozing off next to her husband Joe when she heard Tammy Lynn crying. She got up, went to the other end of the apartment, and tried to quiet her. Faced with a fussy infant, she felt miserable and inadequate. Her baby cried all the time. She must be doing something wrong. At some time between midnight and 1 a.m., she went back into her bedroom and got her pillow. She took it to Tammy Lynn's crib and held it over her daughter's face until she knew that she would never cry again. "I didn't mean to hurt her," Marybeth told police. "I just wanted her to stop crying." Marybeth was calm after she suffocated her baby. She thought about the story she would tell her husband. Then she put the pillow on one end of the sofa as if she had been watching TV. Then she screamed for Joe. When Cynthia was awakened that night by her ringing phone, she knew right away that it was something with Tammy Lynn. A light was on in the Tinning dining room, and Joe and Marybeth were waiting for her. Tammy Lynn had been taken out of her crib and sat on a changing table. She was on her back with her hands outstretched, wearing a warm cotton sleeper. Her skin was a cyanotic purplish blue color. She had no respirations, no pulse. So Cynthia took her to the living room floor and immediately began CPR. Marybeth said that the ambulance was on the way. She said she had tried CPR herself, but it wasn't effective. Now Cynthia knew that Marybeth knew that you don't stop CPR. You keep at it until the paramedics take over.
Of course.
So she's pissed off, to put it mildly.
Yeah.
But Marybeth just paced the floor while Joe stood there shaking his head. And Joe was fully dressed. The paramedics arrived and took over the resuscitation, but of course it's too late. The next morning, Marybeth made one call after another, informing people of her baby's death. Her sister-in-law, Carol, dropped the phone and just collapsed into tears. Police officials initially suspected that Tammy Lynn died of SIDS. Dr. Michael Baden, the lead forensic pathologist and member of the state police's special forensic unit, determined Tammy Lynn's death resulted from smothering. Now, Dr. Baden is kind of a famous pathologist.
Yes,
He's been involved in many cases, and he had his own show on HBO, The Autopsy, where he talked about different autopsies he did.
So the chief of Schenectady's police department contacted Dr. Baden to ask him questions about SIDS. He asked Baden if it was possible that 9 children in one family could die of natural causes. Now, Baden told him that it was virtually impossible and asked him to send the Tinning's case files. He also explained to the chief that children who died of SIDS do not turn blue. They look like normal children after they die. If the baby's blue, it would be suspected to be by asphyxia, meaning the only way they could have died was if somebody had smothered them. So on February 4th, 1986, Schenectady investigators brought Marybeth in for questioning. For the first several hours, she denied having anything at all to do with her children's deaths. But then she admitted, "I didn't do anything to Jennifer, Joseph, Barbara, Michael, Mary Frances, and Jonathan. Just these 3, Timothy, Nathan, and Tammy. I smothered them each with a pillow because I'm not a good mother. I'm not a good mother because of the other children." So after admitting that, she was asked to go through each of her children's murders and explain what had happened. A 36-page statement was generated, and at the bottom, Marybeth wrote a brief statement about which of the 3 children she killed and denied doing anything to the other children. She signed and dated the confession. She said she killed Tammy Lynn because she would not stop crying.
So she was arrested and charged with the second-degree murder of Tammy Lynn. The investigators couldn't find enough evidence to charge her with murdering the other children, and she was able to make her $100,000 bail payment and was released from custody until her trial. The murder trial of Marybeth Tinning began in Schenectady County Court on June 22, 1987. Most of the trial centered on Tammy Lynn's death. Dr. Ford, Tammy Lynn's pediatrician, testified on behalf of the prosecution, saying Tinning had dismissed his suggestion that due to the other siblings' deaths, she should use an apnea monitor. 2 additional prosecution witnesses, Dr. Marie Valdez-Dapia of Miami, Florida, president of the SIDS Foundation, and Dr. Thomas Oram, the medical examiner who performed the baby's autopsy, said they had diagnosed that Tammy Lynn was smothered to death with a soft object. So Marybeth was found guilty of the second-degree murder of her youngest child, Tammy Lynn Tinning. During sentencing, Marybeth read a statement in which she said she was not the one who caused the death of Tammy Lynn. She also said she would never stop trying to prove her innocence. She stated, "The Lord above and I know I am innocent. One day the whole world will know that I am innocent, and maybe then I can have my life back once again, or what is left of it." She was sentenced to 20 years to life and was sent to Bedford Hills Prison for Women in New York. And since 2007, she's been denied parole 6 times. One of the items that has led to the parole board's repeated denials is her lack of remorse for murdering her infant daughter. When she was questioned about the murder during her 2013 appearance, she said, "It's just I can't remember. I mean, I know I did it, but I can't tell you why. There is no reason." So that wasn't very satisfying to the parole board.
I can imagine. So the parole board stated, "This was an innocent, vulnerable victim who was entrusted in your care as her mother, and you viciously violated that trust, causing a senseless loss of this young life." The board then said, Discretionary release would so deprecate the severity of the crime as to undermine respect for the law, as you place your own interest above those of society's youth. So she was denied parole for the 6th time in January 2017, and is actually scheduled for another parole hearing later this month, May of 2018.
Yeah, what are her chances of getting out?
Wouldn't think very good.
I think she'd have to change her whole attitude. She'd probably have to go through therapy and admit to everything and have remorse. But I don't think she's ever going to do that.
No.
No.
Well, in her confession, she admitted to killing 3 of the kids.
Yes.
But they only charged her with 1.
Right. And she took back all her confessions at one point.
Yeah.
There's a lot to it. So if you want to find out more about this case, there are some books. There's a book called Mom the Killer, written by Detective Mark Gato. There's a book From Cradle to Grave, The Short Lives and Strange Deaths of Marybeth Tinning's 9 Children, written by Joyce Egginton. Also, there's some HBO stuff. The HBO network reported on her case in the first episode of the crime documentary Autopsy: Confessions of a Medical Examiner. And that was back in 1994, and that's with Michael Baden. This case has also been covered on the Investigation Discovery Network, on the shows Deadly Women, and Most Evil, Murderous Women.
Let's remind our listeners of our sponsor for today's episode, Grove Collaborative.
Oh, one of my favorites.
Good place.
Grove is an e-commerce company that makes it easy to discover the best natural products to take care of your home and family and never run out. With their own safe, effective, and affordable Grove flagship products, as well as amazing brands like Method, 7th Generation, Tom's, Real Simple, Grove delivers natural, beautiful, and sustainable products right to your door.
Grove's a good way to start your transition to more natural home and personal products, especially if you have children or pets in your home. Grove makes you feel good that you are exposing them to only the safest products.
Sign up for Grove Collaborative at grove.co/brewery, and you'll receive a $30 Mrs. Meyer's gift set for free with your order of $20 or more. That's grove.co, not grove.com/brewery. Grove makes it easy to have a happy, healthy home. So before we get into feedback, I just want to take 1 minute to thank our listeners, our Tie Grabber members, our Patreon supporters, and all of you who take the time to send us feedback and your suggestions. We're just happy to have you listen and interact, but if you see some value in listening to True Crime Brewery, and if you'd like an extra episode to listen to once in a while, you can support the podcast by joining Team Tie Grabber at tiegrabber.com or by becoming a patron at patreon.com. As a member, you'll get access to our current members-only TCB episodes and new ones that we release every month. In addition, we'll send you a bottle opener or a snifter after you join. And I also throw in a few more pieces of TCB swag like stickers, magnets, and coasters. We got these great new magnets that are shaped like little snifters with a picture of the snifter.
They're very cute.
They are adorable. So just remember, when you join, it can take a few minutes to get your login email, and if you don't see it in your email, check your junk folder. Sometimes it ends up there because the software sends out multiple emails. There are other ways to offer some support, and you can do that by following us on Twitter, Instagram, or Facebook. We also have a Facebook fan discussion page, which is a lot of fun. Also, if you take a few minutes and leave us a review on iTunes or wherever you listen to the podcast, that's very helpful. So now we'll go on to feedback.
Okay, first up is Michelle, who's commenting on our episode Unleashed about the dog mauling. Just wanted to weigh in on the debate of nature versus nurture. Michelle says many years ago we adopted a full-blooded chow at 8 weeks of age and named him Yogi since he looked like a teddy bear. He was very socialized and very gentle. Our daughter was young at the time, so there were lots of children at our house most of the time. When he was about 4 years old, my husband moved out due to a divorce. And at that point I noticed Yogi took on a more protective role with my daughter and me. He was very loyal and loving even then. Now, as he got older, he gradually became more aggressive to anyone who wasn't in his inner circle. He never attacked anyone as he was always carefully supervised. I have always been puzzled about the change in his personality since we raised him with great care and love. I realized that divorce had an impact on him, but never would have imagined it would have taken that turn. I now believe nature as well as nurture are factors in a dog's behavior. Thanks for the awesome podcast.
All right.
Well, we don't disagree.
No, I agree with that. I think it's interesting, though. I think the dog maybe took over. Was this a male dog?
Yeah.
Yeah.
Yogi.
So maybe he took over as the alpha. Maybe the male person was the alpha. And he decided he was the alpha. And not to be a breedist, but I have heard chows can be aggressive.
Chows are pretty aggressive dogs. Yeah.
Yeah, they can be.
So there's definitely some nature
Yeah.
involved.
Really surprising to me how much we got for a reaction from that case about dogs. People really have a lot to say about that.
Boy, we touched a nerve.
We did. So David from Georgia also wrote with comments on Unleashed. What kind of person lives vicariously through a dog? What kind of person gives off the impression they get off on having the most dangerous and vicious dog, then acts surprised when the monster they helped create kills someone? It's all too easy to anthropomorphize a vicious dog into a cold-blooded killer, and hard to remember that all dogs, and cats too, are predators that must kill another animal in order to live. Some breeds are going to be more aggressive than others. However, humans do, as in almost all cases, step in and make things worse. A large aggressive dog that may not have been a killer of humans becomes one thanks to human intervention. Should the people who went out of their way to tease out the killing instinct of their pets be held accountable? Absolutely. Sadly, the animal also becomes a victim because a human trained it to become a killer, and killer animals are themselves killed. Way to go, humans. Kill, kill, kill. I think there's a little bit of sarcasm there.
Maybe a little bit of sarcasm, right?
No, yeah. Now, I'm not sure I agree about them all having to kill to live. I guess in the wild they do, if that's what he means.
Yeah, but not domesticated animals.
Not domesticated's different, but I totally agree that those dogs were victims because they were put down. Their lives were cut short because they were turned into horrible creatures by these horrible human creatures.
By the humans,
Yeah.
That's right.
I think most problems in the world can be directed right back to humans. So mostly humans' faults. Human fault.
Okay. Another comment on Unleashed. This is from Miranda W., who also has a case suggestion for us.
All right, Miranda.
So first off, I absolutely love you guys.
Well, thank you. We love you too.
And have been listening for about a year now. I just finished listening to the story of the dog mauling, and I'm just so appalled by the entire story. This may be coincidence, but over the last week or so, I have heard of 2 stories here locally, in Oklahoma, where people had been mauled to death by dogs. One woman by pit bulls, and the other by dachshunds.
Yeah.
Now, I read that.
That's hard to imagine.
What are they? They must peck you to death or something.
Well, there are some bigger dachshunds, right, that are like knee-high.
You can have a standard-sized dachshund that's probably 30, 40 pounds, and I suppose a pack of them could do some damage.
But that just sounds funny.
It
Not
does.
to make fun of it, but you just don't expect dachshunds.
Miranda goes on to say that it just goes to show it's not necessarily the breed that causes violence, although I do believe some breeds are more violent. I'm also writing to request you cover the story of the collar bomb case. I found it very interesting and thought it may be up your alley. Although I'm sure you have heard of this case, I am leaving a link to a news article about it. I think Netflix made a documentary I will have to check out. Thanks for being your amazing selves. Love you guys.
So yes, Netflix does have a new 4-part docuseries on this. I get little text updates when something they think is up my alley comes out. And the docuseries is called Evil Genius, the true story of America's most diabolical big heist. So it looks pretty good.
Yeah, the true crime documentary centers on the so-called diabolical plot, which resulted in the death of an on-duty pizza delivery driver. He robbed a PNC bank in Erie, Pennsylvania, with a bomb clamped around his neck. Shortly after the heist, the collar device fastened to him exploded, killing him while he sat cross-legged and handcuffed on the ground. Now, details emerged that the robber, a 46-year-old local man named Brian Wells, appeared to have been a hostage himself, forced to hold up the bank as part of a scavenger hunt he was instructed to complete to save his own life. But at a 2007 news conference, prosecutors said he was not entirely innocent and had a limited role in planning the robbery. So his story, or the story, is that In August of 2003, he was accosted by several men who locked an explosive device around his neck. Then they ordered him to rob the bank. After delivering the money, he would receive clues to help him disarm the bomb. One of the most ingenious bank robbery schemes in history, it was known as the collar bomb by the FBI. And unfortunately, it did not go according to plan. Wells was picked up by police shortly after the robbery, never did find the clues he needed in order to disarm the bomb around his neck, and he died before the bomb squad could arrive. Sadly, his death was on live TV.
Oh, I don't want to see that. I hope that's not in the documentary.
Investigating the crime after his grisly death, the FBI soon discovered that Wells was not, in fact, an innocent victim, but merely the first co-conspirator to fall in a bizarre trial of death following the crime. Well, that sounds interesting.
It does. I think we should watch it.
That vaguely, about the collar of death or whatever it was called.
Well, let's binge that documentary and then we can decide if we want to do it.
Okay, let's.
So Natalie M. has another comment on Unleashed, but on a different aspect. It's about the adoption aspect. Remember how the couple adopted that older prisoner. Dear Jill and Dick, I'm writing in regards to the adoption aspect of this case. You mentioned you hadn't heard of something like this happening before. I've only heard of it myself once. Apparently, heiress Doris Duke adopted a 35-year-old woman, Shandi Hefner, in 1988 for the purpose of having an heir and believing her to be the reincarnation of her deceased infant daughter. Though after a falling out, Duke would change her final will to remove Hefner and negate her adoption. Your podcast is one I always look forward to. Thank you, Natalie. I love the way you don't mince words when giving your opinions on the criminal subject. A dirtbag is a dirtbag, and you don't mince words. I'd like to suggest a murder case which occurred in my hometown in 1995. The murder of 73-year-old Enola Boudreau. The mother-son duo, Diane Below and Sonny Goodry, were neighbors of Boudreau. They mysteriously left town several months after she was found murdered in her home, stabbed and slashed repeatedly. I was in junior high at the time, and one of my close friends was Below's daughter. A mutual friend of ours mused after the family's sudden departure that it was odd how our friend's family just picked up one day and left. We managed to exchange addresses, and I got a letter from her a few months later from Guthrie, Oklahoma. I wrote back but never heard from her again. I don't know if she was prevented from further correspondence, but if I murdered a neighbor, I wouldn't let my teenager write back to someone in her hometown. In 2011, an email was received by Lafourche Parish Sheriff's Office alleging that Below had destroyed evidence from the murder. Goodry confessed, though his mother wouldn't answer questions. Goodry was found incompetent to stand trial and the charges were dropped for Below. Goodry was sent to a mental institution with hopes that he would eventually be able to stand trial. Below returned to Oklahoma where she was arrested for enabling the sexual assault of a child by Goodry. I believe this would make an interesting story for y'all. Lots of small-town secrets.
It does look interesting.
It does, and it sounds a little familiar. I might have seen something on this once.
Okay, let's check it out.
Okay, we'll look into that. Thank you very much, Natalie.
This is from Cindy C. This suggestion list and the rationale for the requested cases is a somewhat long email. I appreciate that you read our feedback.
And I did edit it a little bit, but it is a little long.
Here are some cases that I have read books about and have sparked my interest. I read talking books as I'm blind. Like you, I'm interested in the criminals' backgrounds in their early life. Your programs enthrall me, and I watch you on YouTube. So Cindy goes on to say, in the book Alone with the Devil, several cases are discussed, and Ann Rule has many separate case files in her books. Please do podcasts and put on YouTube, as well as others mentioned below. She's
very specific about what she wants us to do.
So we've got Richard Chase, the Vampire of Sacramento, Charles Whitman, who's the Texas Tower Killer, Eric Chapman, Roger Anderson, Domingo Camacho. On Facebook, I'm in some anti-bullying groups and I'm interested in crimes around bullying. One particular crime which I read about was the case of Shonda Scherer's murder. Please do a podcast on her killers and others on teenage or younger killers.
We have done that one.
We've done Shonda.
You should be able to find that one. It's called Mean Girls.
I'm also deeply saddened by the innocent babies who are murdered. Please do discussions podcasts on the following criminal mothers: Marybeth Tinning, Martha Woods, and Juanita Hoyt.
Well, obviously, this is Marybeth Tinning we just did.
So we can cross her off.
Yeah.
Another interest is crimes committed in a place where you would come to receive first-rate medical care. Please do podcasts on the following doctors and nurses: Dr. Michael Swango and Nurse Janine Jones. Swango is suspected or has been convicted of killing a bunch of people.
Oh, yeah?
Yeah, he's interesting. And another place you would think would be safe is a church or school. These have really frightened me lately. The shootings in the church in Texas, in Charleston, South Carolina, also Newtown, Connecticut, Columbine, and other schools.
Well, we just had one the other day.
In Santa Fe, Texas.
Yeah.
Last but certainly not least, in the book Blood Letters and Bad Men, there is a man not to be confused with the carpenter's Richard Carpenter. This carpenter lived in Chicago and was 7 or 8 years older than the singer. Is that who you're talking about?
I'm guessing, yeah.
He shot a policeman and held a family hostage. This was in the mid-50s.
So we can't talk about all these recommended cases, but you did bring up Michael Swango. So why don't we have a little background on that one, because that's an interesting one. I've got a little blurb here.
Okay. He is an American serial killer and former physician. It's estimated that Swango has been involved in many fatal poisonings of patients and colleagues, although he's only admitted to causing 4 deaths. So since he was a child, he was fascinated with stories about violent deaths, and he later became obsessed with the Holocaust, with particular interest in vivid images of death camps.
Well, that's disturbing.
Is it not? He even maintained several scrapbooks with articles and pictures on disasters and crime scenes. While at Quincy University, he developed an obsessive interest in poisons, and this occurred while he was doing a thesis on the bizarre poisoning death of Bulgarian writer Georgy Markov. Throughout his life, he served in a number of medical facilities, often being fired for his involvement in mysterious deaths. He usually administered high doses of dangerous drugs to his patients and poisoned his co-workers and acquaintances. The book Blind Eye by James B. Stewart estimated 35 deaths caused by Michael Swango, while the FBI believes that he is responsible for about 60 deaths, which would make him one of the most dangerous serial killers in American history.
So I think I'll look into doing that one for sure.
Yeah, I didn't know he was that proficient.
Yeah, prolific, right?
Definitely.
So I have another case suggestion from Martin M. Please cover the case of Dr. Adam Frash, a Florida podiatrist accused of killing his wife. Nearly 3 years after his wife Samira was found dead at the bottom of the pool at her Golden Eagle home, podiatrist Dr. Adam Frash stood trial for her murder. So Frash, 49, was a jet-setting foot doctor with a suspiciously lucrative practice. I was going to say, how rich do you get as a podiatrist? But he was, I guess, a businessman.
That's one way.
Yeah.
You can also defraud insurance companies and Medicare.
I think that was the case here.
That's probably the easier way.
Right. He had a penchant for women, luxury cars, and fancy sunglasses. Samira, his third wife, was born in Madagascar. She met him in the summer of 2006 during Fashion Week in Paris. Described by her husband as a one-time supermodel, though there is really no evidence of that, Samira married him in 2009. She arrived in Tallahassee the following year to learn her husband, who was married when she met him, had fathered a child with another woman. This revelation sparked what would become what friends called a love-hate relationship until her death, months after she finally filed for divorce and won custody of their house and their 2 young girls. Frash has steadfastly maintained his innocence. He says the couple was reconciling and had been intimate the night before she died, before she launched into a champagne-fueled rage after learning of yet another affair with a stripper in Panama City. I've never heard of a champagne-fueled rage.
Well, we could just say an alcohol-fueled rage.
Yeah, but champagne makes it sound classier.
Doesn't it?
Yeah. When he left the next morning, he said he took their children at her request so she could rest. He was arrested at his home in Panama City Beach hours after her body was discovered. People close to Samira say she feared for her life and never would have let him take her babies, the eldest of which she was grooming as a celebrity toddler. Prosecutors argue no one but Frash had the motive and the opportunity to see her dead, and he was also having an affair with the kid's nanny.
We've seen this.
I thought we'd seen something on that. I remember the child. I remember not liking the way the child was dressed up.
Right.
Yeah.
But yeah, they were both very flashy.
Yes, very flashy.
That'd be a fun one to do.
It might be fun to do.
And I have one other one, Linda D., with a case suggestion. So she says, hi, Dick and Jill. Hi, Linda. I
Hi,
would love
Linda.
for you two to cover the Kathy Cousins case. You both have a great way of talking about the outrageous behavior of many criminals, and Kathy was really outrageous. So Kathy Cousins was 29. Her lover, Timothy Coyle, was 36. They killed Kathy's Palm Beach Gardens husband, Sean, nearly 20 years ago, and dumped his body in a Florida creek, or ditch. Kathy had been married for 3 years to Sean Cousins, who was an abused husband. He often had bruises on his body. The word on the street was that the bruises occurred during domestic altercations with his wife. Now, Kathy was described as a vengeful and envious woman with a violent side. So she began a love affair with handsome neighbor Timothy Coyle, who was a married man just recently moved into the neighborhood. The affair was the subject of gossip, but things got serious when Kathy's husband, Sean, disappeared. He was found days later with bullet wounds in his body. Phone records connected Timothy Coyle and Kathy Cousins to his death. They were both charged with his death in November of 2002. Now, to avoid the death penalty, Coyle told police his version of what happened that day. According to Coyle, he walked in on a murder in progress. He said Sean Cousins was wounded, gasping for air, and begging for his life. Kathy Cousins told him to finish the job, but when Timothy wouldn't go through with it, Kathy shot her husband in the head. Then she taunted Timothy Coyle, who she once thought was sexy for being spineless. After they killed Sean Cousins, they dumped him in a ditch. At their 2003 trial, prosecutors alleged Kathy Cousins killed Sean Cousins to collect on the insurance money and to live with her lover, Timothy Coyle. This was recently covered on an episode of Diabolical.
That's I think that's a fairly new show on ID.
Yeah, we haven't watched it, have we?
I've been recording them, but I haven't watched them yet, so
Oh.
we'll have to look for that one.
Let's start it up.
There's just too much crime and not enough time.
I know.
I'm going to have to get a t-shirt that says that.
That's a new mantra.
So much crime, so little time.
Yeah.
Yeah.
Well, that's going to do it for today.
Thank you, everyone, for listening. We appreciate it so much, and we'll be back again next week with another episode of True Crime Brewery down at the Quiet End.
We'll save a seat for you.
Bye-bye, everyone.
Bye.